It's our sunshine.
Hello, I am Dr. Sampurna Ghosh, ENT consultant, Sunshine Hospital in Gachibowli branch. Today's topic is about myths and facts of sinusitis. Many patients come to my clinic saying, Doctor, I have sinusitis. So my next question will be, what is your symptom? 90% of them say, I have headache. There is a myth in the society that headache is equal to sinusitis, which is most of the time is not right. Headache may have some 100 causes. Sinusitis can give rise to headache, but that accounts to a very small percentage of headache. So you must know first what are the symptoms of sinusitis. The sinusitis patient will have definitely some kind of nasal obstruction, stuffiness in the nose, congestion, some kind of secretion. They complain of postnasal drip. The secretion may be thick, greenish or yellowish. Sometimes they get bad smell out of their own nose. If you have these features along with that headache or any kind of facial pain, then we suspect that that pain is because of sinusitis. There are basically two major kind of sinusitis. One is acute and one is chronic. If your sinus symptoms are only for 7 days, 10 days, it is reduced by antibiotic and proper medication. It is acute sinusitis, nothing to worry. Every people in lifetime will have acute sinusitis for some time. But if the sinus symptoms whichever I described now are persisting for 4 weeks, 6 weeks, 2 months like that, then we call it chronic sinusitis. How do we diagnose? ENT surgeons have a magic tool in their hand, which is endoscope. So we always prefer to examine the nose with the endoscope attached with light source camera with the monitor. We get a fair good idea about the nasal passage, how the sinus openings are. We can see some kind of drainage from the sinuses, congestion, and we can suspect whether this person has sinusitis or not. The second most important investigation in today's ENT practice is CT scan of the paranasal sinuses. A decade back, most of the people used to advise maybe X-ray PNS, till few doctors do write that. But you must understand, X-ray PNS can give an idea about few sinuses, the maxillary, the frontal, but it cannot give a whole idea about all the sinuses. What are sinuses? Sinuses are nothing but air-filled cavities within our skull. There are different group of sinuses named differently for the benefit of classification or describing it. The one which is here in the cheekbone, below the eye, and in this area above the jaw, this is called maxillary sinus. It is a pyramidal space. The another sinus which is here above our eyebrow in the forehead, that is called frontal sinus. We have one pair of maxillary, one pair of frontal sinus. The other important group of sinuses are ethmoid sinus, which is in the dorsum of the nose. They look like honeycomb. There are multiple partition wall in these sinuses. It consists of multiple small cells. The last but not the least most important is sphenoid sinus, which is in the depth of nose, which just lies below the pituitary gland and the brain. So all these sinuses we can have a 360-degree view and a 3D idea if we do a CT scan of sinuses. What is the treatment of sinusitis? As I already told you, acute sinusitis can be easily treated with medication, but chronic sinusitis needs to be classified further. Chronic sinusitis can be bacterial, can be allergic fungal, or simply fungal. Fungal varieties are usually seen in immunocompromised people like diabetic or HIV. That can be again chronic indolent or chronic invasive. Most commonly we are getting bacterial and allergic fungal sinusitis. These kind of sinusitis require treatment both from surgical side and medical side. If the sinus openings are blocked because of polyp or infection or edema, it is very important to surgically open the drainage pathway. Once the drainage pathway is open, the bad secretions, the discharge which is accumulated in the sinuses for many years, that come out, and then we can send those discharge for microbiology or pathology tests. The medical therapy should be continuing after the endoscopic sinus surgery. Endoscopic sinus surgery is not a one-way solution. the surgery patient must come to the doctor for follow up with regular interval, sometime weekly once or sometime monthly once, or it can be once or twice in a year. Depending on their progress, their healing, the doctor will decide whether we can stop the medication or sometime we need to continue the medication. Many people ask, after surgery will it come back? So there is no guarantee obviously that it will not come back, because sinusitis and nasal polyps are a kind of disease which are notorious to come back. But how to prevent that? If you regularly come for follow up visit, there are medicines. In the very beginning, when we suspect is it coming back, we can start the medicine and it will be stopped at that very point. Not all sinusitis come back, only the fungal varieties and the polyps, there are rare chance that they can come back. But the summary of this talk today is, sinusitis are of different kind. Many a times people don't suspect they have sinusitis, whereas they actually have. Sometimes people are very confident saying from childhood I have sinusitis, whereas after doing the endoscopy and CT we see that person doesn't have sinusitis. So if you have any kind of symptom like this, or if you suspect yourself that probably my headache is from sinusitis, it is an honest advice from me that visit your ENT surgeon, get it checked by endoscopy, by CT scan or whatever the doctor suggests you, and it has a treatment. Thank you.
Sunshine, it's our sunshine.